We don't know just yet. You'll be the first to know as soon as we do. But here are some realities that we all need to accept right now. Reality number one, 12 Indian states as we speak are currently already in their own lockdown. Reality number two, experts say weekend curfews and partial lockdowns are not having any kind of effect as desired. Reality number three, the true peak, the maximum peak of the current COVID wave is still looming ahead. Experts say it could happen on May the 7th or May the 15th, anytime between the two. Another reality, there are many experts who believe that partial lockdowns are simply not working. In fact, they could be counterproductive. Reality number five, India has a major allergy to the word lockdown. That is perhaps one of the reasons why we're not really looking at a national lockdown, because of the cultural implications and how it reminds us of the horrors of 2020. Well, the situation now is far, far worse. Another reality, the government has so far said national lockdown won't happen. But the final reality, there are several experts who say a national lockdown is perhaps inevitable. It is still up for debate. There are experts who say that lockdowns don't work and will not really solve any problem in the second wave, but there are many who say it is perhaps the only thing we have left. Now let's just show you where the lockdowns are currently already active. I told you there are 12 states. Let me show you on the Indian map where all there are lockdowns. Maharashtra, Delhi, the national capital, Karnataka, which is seeing a major crisis right now, Rajasthan, Goa, Haryana, Jharkhand, Bihar and Mizoram. So these are the states in the country which are already in lockdown mode. 12 states in all in the country currently. About a third of the country are already in lockdown mode. Let's show you which states in the country already have weekend and night curfew regulations in place. Uttar Pradesh, Kerala, Punjab, Odisha, Chhattisgarh, Madhya Pradesh, Assam, Himachal Pradesh and Tamil Nadu. These are the states that already have weekend and night curfew. So you have to remember now what I was just telling you about the expert view on partial lockdowns, state lockdowns, as well as weekend and night curfews. Now let me give you the 6 metro 360-degree view from India's 6 big cities about where things stand. These are all states where there are some regulations in place, if not statewide lockdowns. And this is in the shadow of the possibility of a national lockdown. Aishwarya Paliwal reporting from Delhi. Saurabh Bhaktania reporting from Mumbai. Pramod Madhav is with us from Chennai. Suryagni Roy reporting from Kolkata. Nolan Pinto reporting from Bengaluru. And Ashish reporting from Hyderabad. Before I go to my reporters though, I want you to listen to one of the experts who has been speaking to India today. One of the most prominent doctors. All India Institute of Medical Sciences Delhi Director Randeep Singh Guleria has backed a national strict lockdown. Says weekend and night curfews are of not much help. Take a look.
Do you think, in the interest of doctors, in the interest of the people of the country, to save more lives, to improve the healthcare infrastructure, a nationwide shutdown of the country is required now?
So I think we need to look at 3 things. One is, of course, improve the hospital infrastructure, which we're doing, oxygen beds and other things. But the second most important thing is to decrease the number of cases. We have to break the chain of transmission. This is a virus which spreads from one human to the other. It's a human-to-human spread. If we decrease close contact between humans, then the virus cannot spread to another person and the cases can come down. And therefore, a strategy of stopping this has to be done. We can call it a lockdown. We can say it could be a regional lockdown based on a graded response, which UK did, depending upon what is the criteria that you want. We could say that if your positivity rate is more than 60%, more than 10%, if more than 60% of your beds in a place are already full, that means you're now coming up to full capacity and you will not be able to manage more patients. You should have a complete lockdown in that area. Whether it's at a state level or the larger level is something that policymakers need to decide, because it's an issue of organizing everything in terms of lives, livelihood, seeing that transport and essential services are maintained, and at the same time looking after those people who are the daily wage workers, the laborers, their care is also looked after. So that has to be done. But I do agree that we cannot just continue to focus only on infrastructure and hospitals unless we also focus on decreasing the number of cases in a very, very aggressive manner. So if we're talking of a lockdown, it has to be for a sufficient duration for at least 2 weeks. It has to be aggressive. It's no point having a weekend lockdown or a night curfew. And secondly, we must really look at how things evolve and then take a sort of a strategic approach. We can unlock early if it's needed, depending on how the cases pan out. At the same time, the third thing that we need to do is try and roll out the vaccination as much as possible. More and more people who are eligible should come forward and get themselves vaccinated, because that will also help in decreasing the number of cases.
So there are lockdowns in different states of the country, but what is the outlook as far as this national lockdown is concerned? Is it something that's inevitable? Now, the second COVID wave has got a vice grip like India. The numbers are rising. Take a look at what the situation on the ground is. Mumbai, once the epicenter of the virus, has reported just 2,624 new cases in the last 24 hours. This is, of course, also due to reduced testing, but that's the official figure. This drop comes after a lockdown was imposed in the state. The national capital, on the other hand, Delhi, has nearly 90,000 active cases, and the city has reported 18,043 cases in the last 24 hours. Delhi also reported a slight decline in its caseload following its own lockdown. Chennai has over 30,000 active cases, and the city has reported over 6,200 new cases in just one day. A COVID curfew has been imposed in Tamil Nadu. In Kolkata, that too is under some COVID restrictions, has over 26,000 active cases, but of which 3,990 were reported in just the last 24 hours. Out of all these cities, Bengaluru is the worst affected metro. The city has 2,94,917 active cases. It reported over 22,000 cases in just the last 24 hours. So I'm going to start with Aishwarya, who's with us live from Delhi, and we have all 6 reporters from the 6 cities. Aishwarya, lockdown prevalent currently in Delhi. How does this match up with the expert view that ultimately perhaps a limited national lockdown is going to be necessary?
Well, Shiv, definitely we will see some kind of lockdown. We are seeing how the national capital was amongst one of the first states to impose a lockdown, and Arvind Kejriwal, in fact, has been extending the lockdown week after week. And just in the last 24 hours, 448 people died. Shiv,
Yes.
which means every hour 18 people have died in the national capital. So definitely the situation is grave. If you talk to the hospitals, they are still facing shortage of oxygen. So it looks like the entire country is gearing up for some sort of national lockdown, maybe not as severe as the one we saw last year, but definitely the need of the hour is to make sure we break the chain.
Nolan, coming to you, Bengaluru, currently the worst affected metropolitan city. What is the situation there? Karnataka is in lockdown. There have been a spate of very troubling cases there. Are the people of Bengaluru and Karnataka expecting that this becomes a national lockdown?
Well, there's so much talk about it, Shiv. Everyone is actually speaking in hush-hush voices as such. Now, what we are learning from our sources is that 12th is the normal day. 12th of May at 6 a.m. is when the current 14-day corona curfew ends.
Yes.
But our sources tell us that the Chief Minister might extend it by around 7 to 10 more days. Shiv, it's very important because the state on an average, in spite of the corona curfew, is registering about 45,000 on a daily basis. That is for the entire state. The positivity rate is also very close to 30% now. And Bengaluru, like you rightly mentioned, we are very close to 3 lakh active cases.
Yes.
Out of 4.5 lakh active cases in Karnataka, 3 lakh are from the city itself. So there's no other option for them but to actually make it more stringent. Karnataka, the Chief Minister does not want economic activities to go for a toss. He's allowed industries to be open. He's actually allowed supermarkets to open till 12 o'clock. He's allowed a lot of leeway he's given. But that is really not working. Experts I have spoken to say that if you want to break the chain, you must make people sit indoors. That's the only option.
Ashish, in Hyderabad, we have seen a scare with what is understood to be an even more virulent strain. We've seen your exclusive interview with the top scientists and officials there as well about this new virulent strain. In light of all of these, is a national lockdown looking quite inevitable from Hyderabad?
We have two Telugu states, Andhra Pradesh and
Yes.
Telangana. In Hyderabad, in particular, so far government has in Telangana and in Hyderabad, government has imposed night curfew or night lockdown. That too after Hyderabad High Court criticized the government on over the steps it was taking to curb the COVID-19 spread in Telangana. Yes, the government has extended night lockdown, but so far we have not heard anything about a full or complete lockdown in Hyderabad or in Telangana. Yes, Hyderabad has over around 80,000. In fact, Telangana has around 80,000 active cases, largely located in Hyderabad. Similarly, in Andhra Pradesh, though their cases are rising in a sharp number, we witnessed that how over 23,000 cases were reported early on Sunday. So, government of Andhra Pradesh has decided to impose a full lockdown.
Okay.
From tomorrow morning onward, government will impose a complete 14-day lockdown in the state. There are certain relaxation, but largely it will be a strong and strict lockdown in Andhra Pradesh.
Okay. Pramod is with us live from Chennai. Pramod, election season over, things settling down hopefully there. But you know, the restrictions that were put in place by the earlier government appear to have worked, even though we are seeing record numbers in Tamil Nadu as well. Are the people of Chennai also expecting that there will be a national lockdown?
Well, definitely, Shiv, when it comes to Tamil Nadu, just like you said, elections are over, but the numbers are picking up. In fact, last year, the maximum number we had was around 7,800, but currently we have crossed 20,000 and we are nearing 21,000. In fact, we are in a busy market in a location called Srinagar in Chennai, and you could see the kind of restrictions that have been brought forward. For instance, larger shops are shut, but at the same time, smaller shops are allowed. We are also having night lockdown, that is from 10 p.m. to 4 a.m. We have total Sundays lockdown. We have no meat, poultry or fish stalls to function on Saturdays. But is it working on the ground is something very difficult to find out, because for the past 2 weeks, we've been seeing numbers increase at least by 1,000 per day. In fact, for the past 2 days, it has crossed 20,000, and that's the reason starting from 6th May to 20th May, we are having extra restrictions by which hotels and restaurants and tea stalls will only work until 12 p.m. The two takeaway services, whichever location they want to control the crowd, the state government is trying to do so. And the other part here is that we are going through a transition of government. M.K. Stalin is expected to become the chief minister on 7th of May. So the officials have to go to his home, get his approval, and only through the chief secretary's name they are releasing it. But however, this is the way the lockdown has been brought in here. Large shops are closed, no public access to them, but smaller shops are open. When it comes to the public, they are not ready for a huge lockdown because they are still recuperating from what occurred last year. But still, it looks like we have to go through some sort of lockdown to bring down the numbers.
That's absolutely right. You know, that's what the experts are saying. The other state that's just come out of a very big crowded election is West Bengal. Anupam Mishra reporting from Kolkata. Anupam, the numbers on the rise in West Bengal as well. What's the perspective from there about the possibility of another national lockdown? The government has so far resisted it, but it looks like it could be an inevitability in the weeks ahead.
Yes, Shiv, let me brief you the situation here. Mini lockdown was announced few days back where shops, marketplaces, shopping malls were only allowed to open for 5 hours in a day. And day before yesterday when Mamta won, and she told us that her first priority is to combat COVID. And right now, what is the situation here is that Mamta is still to settle. She will be taking oath tomorrow morning, and I think it will take 2 to 3 days to settle her in. And after that, we might expect some kind of regulations or lockdown from her.
Okay, absolutely. Very interesting because the fact is all of these states already have their lockdowns in place, but could it all actually come together? Saurabh, you're in Maharashtra. You've been reporting right through this entire crisis. Thankfully, the numbers have, dropped considerably in Maharashtra. There may be other factors, including reduced testing, etc., but it is still a very reassuring figure if you take it at face value. What is the perspective from there? Are the state lockdowns and curfews, etc., are they working well in Maharashtra?
Shiv, it is working well, and you must know that Maharashtra was the first state to announce lockdown.
Yes.
It's almost over 1 month that Maharashtra is into lockdown. There are selected states, over 9 states and 1 union territory, which have been declared that none of the citizens from those states can enter Maharashtra without RT-PCR test. Now, very interestingly, when the last time Maharashtra Chief Minister Uddhav Thackeray spoke to the people of Maharashtra, he clearly said that cases are not increasing. The cases are stagnant, and if we bring down this COVID figures regularly, then he said that in very next 1 or 2 weeks, we'll also start to lift some restriction. So at a time when we are seeing towards the national lockdown, here the Chief Minister of Maharashtra is saying that there is no more restriction needed in the state of Maharashtra, and especially for Mumbai, he said. Now, the other part over here, Shiv, is the number of testing in the state, in the city of Mumbai. Now, BMC Commissioner Iqbal Chahal yesterday mentioned that it should be estimate of around 40 to 45,000 tests per day in the city of Mumbai.
Okay.
But that is not happening on ground. Now, he is saying that people should go ahead and do a testing, but it is the responsibility of BMC as well to conduct aggressive testing.
Okay.
Now, yesterday, Mumbai did only 23,500 testing, which is very low. So, testing has to be increased, but also same time, the lockdown which is imposed in the last 1 month, it may get extended for another 15 days.
Okay, thanks very much to all of you for joining me on this story, because like I said, the fact is that so far there has been an institutional resistance to call a nationwide lockdown. In fact, the government has already said that there will not be any big lockdown, but given the way things are going, is that going to be something that will have to be reconsidered? A storm that has shaken the country. That's how Prime Minister Modi, remember, has described the second COVID wave in the country. He's also insisted on not imposing another national lockdown, saying that it can only be the last resort. But his political opponents don't seem to agree. Former National President of the Congress and Kerala MP Rahul Gandhi has taken to Twitter yet again to say that the government of India's inaction is killing many innocent people and a lockdown is the only option. He added that the government of India doesn't understand the seriousness of it and the only option left is a full lockdown. Rahul Gandhi has also demanded the implement of the Congress's Nyay scheme for vulnerable sections. Rahul had tested COVID positive a couple of weeks ago. He hasn't been seen in public since. He's been communicating only through his Twitter handle. Now let's show you the case for and against the national lockdown idea. And this is something that's very much a debate that's happening within the corridors of power at this time. Now let's take you through what the arguments for a national lockdown are. One, it will of course arrest or help arrest the sharp rise in cases. It will break the pandemic chain, hopefully. It will allow time to boost health infrastructure. Will give the government, some breathing space to maybe strategize its response, and it can give, much needed respite to health workers. So those are the arguments for a national lockdown. But here are the very, very strong arguments against a national lockdown about whether it is the only option. Here are the ones against. A decline in cases may just be marginal if you actually have a big lockdown. It hits the economy and our poorest sections the hardest, make no mistake. It is a very, very big thing to consider. It may spark another big migrant exodus across the country, and we all saw how it happened last year and the way it was handled. It was an absolute disaster. There can be large reverse migration, which could add to the number of cases. We're already seeing an explosion in cases in the rural hinterland during the second wave. Mini lockdowns by states are already in place. So is there a need to expand this really into a big national lockdown? Now, a day after Delhi started its vaccination